A very warm welcome to everybody to this webinar for the first call of the NIHR Global Health Research Centres. We're extremely grateful that you could join us for this webinar to introduce this very exciting new initiative. Next slide, please. I'll shortly introduce all the speakers, but I'd just like to start with a bit of housekeeping. So we've set all your cameras and microphones off and to mute, apart from the panelists and the people speaking and some of the individuals from NIHR and the Department of Health who are attending this webinar. We are recording this webinar and we'll make it available afterwards on our YouTube channel. If you have any questions during the webinar related to the content, please use the Q&A button that you can see hopefully in the bottom and the middle of your screen. What we will do with these questions is we will answer as many as we can today at the end of the webinar, but all questions will be answered. If we don't get to yours, it will be answered in a document that we'll place on our website, and we'll update with questions throughout this stage one process and questions and answers through the stage one process. So those submitted today and any that you submit to us subsequently will all be answered anonymized and the responses made public. Please let us know of any difficulties that you're having with the platform, connection or sound problems. Please let us know using the chat function, and we'll try and do what we can to assist. Next slide, please. So as I say, a very warm welcome. We're very excited at the unbelievable response we've had to this so far. My name is Mike Rogers. I'm the Assistant Director for Global Health Research at the NIHR Central Commissioning Facility. And my team are operating this call. And I'm going to be joined today by Alex and Sylvia, and I'm just going to let Alex and Sylvia introduce themselves. So Alex.
Good morning, everyone. I'm Alex Edemilton. I am Head of Global Health Research Programs at the Department of Health and Social Care in the UK. Thank you.
Hello, everybody. Hello, everybody. My name is Sylvia Annie, and I'm a Senior Global Health Manager at the National Institute for Health Research in the UK. Warm welcome to everybody.
And Sylvia's our lead for this scheme, so you'll be hearing a bit more from Sylvia and Alex shortly. Next slide, please. So here's today's agenda. We're firstly going to give you an introduction to the NIHR's portfolio in global health research. Some of you may be aware of this, but this might be new to some of you. NIHR may be new to some of you as a funder of global health. Then we're going to tell you about the new census scheme, including the aims and the structure. We'll provide some information on the application process, and then we'll hopefully have some time for questions and answers. And again, a reminder to pop any questions that you have in the Q&A box. So I'm going to hand over to Alex now, and next slide, please.
Thank you, Mike. Just to repeat, I am Alex Edemilton, and I am Head of Global Health Research Programs at the UK Department for Health and Social Care. So what I'm going to do for the next few slides is just to give a quick overview of the NIHR Global Health Research portfolio, situate that within the wider context of UK official development assistance funded research more broadly. And then we'll get a chance to go into the details of the NIHR Global Health Research Centres program, which is what we are really here for. Next slide, please. So just as an introduction to the NIHR, the National Institute for Health Research, is the largest funder of applied health and social care research in the UK. We tend to do this by supporting and delivering high quality research, engaging patients, carers, and the public in the whole research pathway, attracting, training, and retaining the best researchers, and creating a career pathway for them, investing in world-class infrastructure, and supporting the workforce, the surrounding workforce that enables research in the wider research system, and partnering with other public funders, charities, and industry to help deliver the health outcomes for the public. That are really the end point of the investments in research we manage. Since 2015, we have taken this approach and applied it to global health research for the direct and primary benefit of people living in low and middle income countries through our global health research portfolio. Next slide, please. So that portfolio, this slide is just to illustrate where our global health research portfolio sits amongst the wider investments from the UK government in R&D using official development assistance. So at the top, you can see the Foreign Commonwealth and Development Office, formerly DFID, which has a significant investment in R&D, including a significant health research investment. Along the middle row, you can see the Department for Health and Social Care, which received the first significant investment of official development assistance in 2015, through which we set up 3 significant programs. The first, which is highlighted in orange there, is the NIHR Global Health Research Portfolio, which is what we're talking about today. We also have a program of global health security and some work with the WHO on tobacco control. You also have some programs you may be familiar with, for example, the Global Challenges Research Fund and Newton Fund. And the point of this slide is to really illustrate that the NIHR Global Health Research Portfolio is distinct from those other schemes and funds you may be aware of. But we work collaboratively and in partnership with our other UK government department partners to ensure we have a coherent approach to health R&D, all the way from discovery research to applied global health research. Next slide, please. So this slide really just illustrates the key aims of our portfolio, the overarching aims of our portfolio. What we want to do is invest in applied health research relevant to the unmet needs for the direct and primary benefit of populations in low middle income countries. And you'll see us come back to this theme over and over again throughout this presentation, but it's because for us, that's actually at the heart of what we're doing. It has to be for the benefit of those populations. We want to work collaboratively with global health partners, whether in the UK or internationally, to deliver those health outcomes in response to global health challenges. And we want to ensure a sustainable pipeline of the global health research community to allow this research to carry on and be sustainable into the future. Next slide, please. So this slide is really just to illustrate the kind of work streams that underpin that portfolio. The portfolio is broadly divided into programs. So those are incentives and initiatives directly delivered by the NIHR, of which the Global Health Research Centers program is the latest addition. Like I said, we also work in partnership with other funders, for example, the Wellcome Trust and UKRI, to deliver other activities, either collaborating or co-creating new ones where we feel there is a gap. And across both strands, programs and partnerships, we invest in those research career pathways, the people that actually enable research to be delivered. This whole portfolio is underpinned by 3 real principles. So meeting that official development assistance criteria I talked about, and which I will keep going on about around the direct and primary benefits, but really integrating into and building on the NIHR's principles of impact, excellence, effectiveness, inclusion, and collaboration, and all the way strengthening the research capacity through equitable partnerships. Next slide, please. I mean, we are really pleased that since we started this program, we have since developed, really directly from the NIHR, 5 key initiatives. You may be familiar with some of these. The Global Health Research Unit and the Global Health Research Groups were the first ones. And these are researcher-led schemes that allow any research investments that is for the direct and primary benefit of people in low middle income countries to be funded. We then have the Research and Innovation for Global Health Transformation Program, the RIGHT call, which I really want to stress. We have a call open in this scheme in injuries and unintentional injuries and accidents. And it is the first time the NIHR is going to fund a scheme where researchers and the institutions in low middle income countries can directly apply for funding. We also have other schemes focused on health policy and systems research. And of course, we are here to talk specifically about the Global Health Research Centers. What I'll say to everyone on the webinar is please look at the NIHR website to see that you are applying for the right scheme for your research. As like I said, we have several schemes open at the moment. But at this point, I'll hand over to my colleague, Dr. Sylvia Annie, to tell us a little bit more about the Global Health Research Centers scheme. Thank you.
Thank you very much, Alex. In the next couple of slides, I will share with you what underpins the design of the Centers program. Next slide, please. So the NIHR Global Health Research Centers. Firstly, the Global Health Research Centers program emphasizes 2 very important aspects. The first is a shift of the center of gravity from high-income country research settings to low-middle income research environments. So there's that complete. And secondly, an equal focus on research capacity strengthening. So here you have 4 bullets talking about the shift and the importance of research capacity strengthening for the Centers program. Next slide. So what are the aims and objectives of the Centers program? Well, the overall aim is to respond to local needs within the low middle income country in the area of non-communicable diseases. And by doing that, improve the health outcomes within the LMIC. So that's the main objective. Then we have 4-fold objectives, sub-objectives, which are strengthening the LMIC institutional capacity, strengthening research career pathways across partner institutions for researchers, for masters, PhD students, postdocs, academics, fellowships. The aim is to strengthen that career pathway. Thirdly, engaging with stakeholders, and this is very critical because we would want the outcomes of the research to inform policy and practice. And then we also look at delivering high quality research to increase the global evidence of non-communicable diseases. Next slide, please. So here we have the center structure. And as you can see, it's a consortium. So it's an institutional-led consortium, and it's led by an LMIC director based in a research-intensive institution. Now, the LMIC director is supported by a UK deputy or co-director, also based in a research-intensive institution. So in addition to that, we propose up to 3 less research-intensive co-applicant institutions in LMICs. And in these institutions, the co-applicants presumably would be based. Now, the important thing about the research center structure is it's flexible in terms of which UK institutions play the role of co-deputy director, which LMICs, who would lead from an LMIC country, who the co-applicants would be, the geographic areas, how many collaborators you choose, the service providers. So that flexibility is there. And therefore, it allows you to define the consortium best suited to address the local non-communicable diseases needs within the LMIC. Next slide, please. As I mentioned before, there are 2 very important aspects of the Centers program: research that is of high quality and research capacity strengthening. Now, this slide shows important areas to note. Number 1, institutional research plans that focus on more than one NCD in an LMIC population. And when we say that, we are applying this to the entire span, i.e. from fetal development right through to aging populations, if that's acceptable. Secondly, sustainable applied health research capacity strengthening and community engagement and involvement. It's important to show how the community will be engaged, will be involved, how they will benefit from the research. Thirdly, innovation in the development and evaluation of cost-effective interventions and looking at the entire spectrum: prevention, treatment, management, and care. And fourthly, research to strengthen the healthcare systems in the LMIC with the view to improving diagnosis, management, and care for those affected by NCDs. In terms of funding, the funding levels are up to £10 million over 5 years, up to £10 million over 5 years. Next slide, please. Next slide, please. And again, to emphasize the equal importance we place on research capacity strengthening. The Centers program will support the development of a critical mass of sustainable research capacity, and therefore it would promote mentoring, coaching, career development, research management. How do we strengthen the research offices, for example? And also very, very important are the support functions. So issues of finance management, project management, IT, community engagement and involvement, monitoring, evaluation, learning. All these facets are allowed under the Centers program. And the aim of all of this is to work towards an enhanced NCD research culture within the LMIC. Next slide. Now I'll pass on to Dr. Rogers, Mike, who will discuss the application process for the Centers call. Mike.
Thank you very much, Sylvia. Just a reminder to place any questions in the Q&A box, and please don't wait until the end. If you can pop them in as soon as they pop into your head, we'll make sure we can get answers to those. So I'm now going to talk about the application process and also provide some information on things like eligibility and the selection criteria that our funding committee will be using to assess applications. Next slide, please. So firstly, eligibility in terms of official development assistance. Your application must demonstrate clearly on how it meets official development assistance ODA compliance. What we're talking about here is that your application is going to have to demonstrate, firstly, which lower and middle income countries on the OECD's DAC list of ODA eligible countries are going to directly benefit from the research you're undertaking. Secondly, how is the application directly and primarily relevant to the development challenges of those countries? And finally, how will the outcomes promote the health and welfare of people in these countries that are present in your application? Failure to do this properly will render your application ineligible. So it's a very, very serious undertaking to ensure that your application fits with this. Also, just to say, where some elements of the research are not undertaken in an ODA eligible country during the course of the award, the application must very clearly state the reasons for this, with due consideration to the benefits of the research to ODA eligible countries. Next slide, please. So this is what your award, if you're successful, will support. So what we're talking about here is institutional level applied health research. So we don't want to see basic research, lab science, translational research. This is applied health research, a line of sight implementation that primarily addresses the non-communicable disease challenges faced by people and patients in the countries in which you're proposing to work. We want to see you incorporate research questions around things like gender, age, social barriers to health, economic impact and equity that are directly relevant to those countries in which you're working. And we also need you to demonstrate equity and collaboration and program leadership, decision making, the capacity strengthening plans, and all these other things like governance and the appropriate distribution of funds, your ethics, your approach to data ownership, and how the findings are going to be disseminated. You'll find in the guidance a list of things that you cannot do using your funding for these awards. Just a few examples of these. Applications that are focusing solely on research with no substantive focus on research capacity strengthening, or vice versa. Your application needs to include both. You must not only include well-established research institutions. The idea here is for established institutions to help bring on institutions that are interested in research but don't necessarily have a long-standing track record in that. You must pay attention to that. And as I say, we don't want to see the inclusion of very limited methodological approaches or a limited focus to things like observational research, secondary research, health policy implementation. Those things are okay as part of a much wider program of primary applied health research. And as I've said, we don't want to see basic discovery science or experimental medicine included here. Next slide, please. So we thought it'd be useful just to show you some things that are eligible in terms of the costs, the things you can spend your money on. We're talking about things like direct costs, which ODA eligible costs that will be incurred by the contractor and any of the joint lead applicants, co-applicants or collaborators in carrying out the plans that you're proposing to undertake. Just need to say that these should be charged as the amount actually incurred and should be supported by an audit record. So we do want this to be done properly. Very specific reasonable costs that centre applicants are eligible to apply for. Costs associated with developing a suitable research environment in the LMIC partner institutions to enable the effective delivery of the planned research and the capacity strengthening activities. We will permit costs associated with formal certification for good financial grants practice, GFGP, if you're successful at stage 2. We want to see a ring-fence fund to support career development through a variety of internal competitive opportunities, such as completing training modules, researcher exchange, or enabling early career researchers to lead on work packages. And costs associated with the monitoring, evaluation and learning of the centre's progress against its stated objectives, the MEL, they are eligible here, and we would encourage you to include them. We see that sort of assessment as an important part of what we're trying to do here. Again, the guidance that you'll find on the website has more detail on ineligible costs. Just a few examples of things that aren't eligible are things like anything that's not ODA eligible cannot be charged. You're not allowed to cost things that are associated with lobbying, political or religious activities. And you're not allowed first or business class travel, per diem costs or entertainment costs through this. We also don't want to see capital investments in new buildings or infrastructure. Refurbishment costs, broadly speaking, should be okay, although we will interrogate those. You're not allowed capital investments in new building or infrastructure. Next slide, please. The application process, it's a two-stage application process. The first stage is an outline application. If you're successful at this stage, you will go through to stage 2, where we will invite you to submit a full application. So we will be trimming down numbers significantly during that process. We are forming an independent funding committee to assess these applications, and I'll give you a bit of information shortly on how they're going to do that. So the funding committee, though, are going to shortlist at stage 1. If you're shortlisted, you'll be invited to submit your full application. At stage 2, the committee will then make funding recommendations to the Department of Health and Social Care. Next slide, please. Here's a schematic just describing the timeline for applications. Please note these. The stage 1 window, which we're in now, closes on the 31st of March. But please note that remit inquiries are going to close 1 week before. So please get these in as early as you possibly can. We very strongly recommend that you ensure everything is in order well in advance of the deadline and inform us of any technical difficulties you may be having. We will notify you of how you've got on at stage 1 in terms of your stage 1 outcome in July 2021. If you're successful, you'll then be invited to complete your stage 2 application. We'll confirm the precise dates for stage 2 in due course, but you can see there the broad timeline for stage 2. Next slide, please. So the funding committee will be asked to review applications against a number of key criteria. In stage 1, these are limited to, firstly, research capacity strengthening, research excellence, relevance, and leadership. We're going to give you a bit more detail on these 4 shortly in terms of our expectations. For stage 2, we'll expand the selection criteria to also include equity and equitable partnerships, governance, stakeholder and CEI, stakeholder and community engagement and involvement, impact and sustainability, and value for money. So at stage 2, you'll be asked to provide quite a detailed finance breakdown. Next slide, please. You must submit online using our research management system. You can see the link there. And user guidance is also available via that link. Again, we very strongly advise you that you and all of your co-investigators familiarise themselves with the research management system as soon as possible. Do not leave this step close to the deadline. Technical unfamiliarity with the system will not be accepted as a reason for late application. If you have any difficulties with this, please do let us know. This is one of the reasons for trying this out as early as possible. We have guidance notes available on the NIHR website. Many of you will have seen these, but these cover things like the core remit and guidance, the stage 1 application guidance, separate finance guidance, and our theory of change for this scheme. As I've said, a summary of questions and answers will follow this webinar, available on the website. And we will also provide a blank offline application form for you as a convenient measure, so you can work offline with all your partners before completing your final application in the system, if that's easier for you. Next slide, please. So I'm just going to run through a bit of detail on those initial stage 1 selection criteria, just to give you a bit of background in terms of our expectations. So the first one of those is research capacity strengthening, as you'd imagine. We want applications to demonstrate a very clear institutional commitment to the development of a strong non-communicable disease research culture and environment within and across all participating institutions, and in particular the co-applicant institutions. This should be supported by very clear identification of institutional capacity strengthening needs. We expect that applicants will seek equity in their approaches to career development, for example, gender of participants. We also expect that applications will demonstrate plans to build, strengthen and expand non-communicable disease research and training through investment at the institutional level, including by supporting early career non-communicable disease researchers, for example, master's, PhD, postdoctoral. The role of joint lead institutions in supporting this should be very, very clear. Applications should outline plans to develop or strengthen the capacity and capability of research enabling functions, as Sylvia's already mentioned. So things like finance, program management, research management. These are eligible costs and we encourage you to include them. This should be through appropriate recruitment and training opportunities to enhance the professional development of individuals and also your institutional processes. So this is a real opportunity to strengthen those processes within institutions. Applications should also outline plans for strengthening systems of evidence use to support dissemination and hopefully inform policy and practice should the research be successful. Next slide, please. So the next criterion, as you'll recall, was research excellence. We would expect that research excellence will be demonstrated through, firstly, the quality of the research design and work plans, so very clear questions and objectives, very sound and detailed design and methodology, clear milestones. Identification of potential risks is really important. We want to have an honest conversation with you about the risks that you may face in delivering your research program, and also factoring in ethical considerations, which we know in some cases will be detailed and numerous. Secondly, we would expect that research excellence will be demonstrated through the strength of the institutional level consortium's research in the chosen non-communicable diseases. So by this we mean things like the depth and breadth of the relevant research leadership and expertise and the track record of the joint lead applicants. And then balancing this off with the need for capacity strengthening in the lower and middle income country co-applicant institutions that are less experienced in these areas of research, and the plans identified and developed by the Centre for Achieving Success. Applicants should demonstrate that the planned research is robust, enables the development of individuals and institutions to produce high quality scientific research evidence and interventions, with the intention of strengthening the local, national and regional environment and systems for conducting internationally competitive health research, which is relevant to the context in lower and middle income countries. In addition, applicants should all outline activities which promote interdisciplinary approaches to working by including expertise and activities associated with a very broad range of disciplines. And here we're thinking about things like clinical research expertise, but also health economic expertise, stats, and also social science, which has been a very important part of our whole global health research program to date. Next slide, please. The next criterion is relevance. So applications should demonstrate that the proposed research and capacity strengthening fills a significant gap and addresses unmet non-communicable disease needs and priorities in ODA eligible countries, and also aligns fully with the scope of the call. The Centre's research plans should be based on a ELMIC-led review of the local needs as related to non-communicable diseases that's rooted in the existing research literature and health systems, and has refined relevant research questions and priorities through knowledge generation and exchange and engagement with policymakers, evidence users, and critically local communities. Next slide, please. And also leadership. The Centre's chosen leadership model and the respective roles and responsibilities of both the joint lead applicants in the UK and in the ELMIC must be very clearly defined and agreed. Evidence should be provided that both the ELMIC and the UK joint lead applicants and the institutions they represent have substantial high quality expertise in the chosen research themes, and are committed and able to support training and capacity development of partner ELMIC institutions that have less or no experience in this area of research if funded. Next slide, please. Few hints and tips here. Obviously, this is a new scheme and we're also partly learning as we go, but just based on the schemes that we've operated so far. First one, you must embed equity in all roles, career development, governance. We don't want this to be basically a completely UK-led enterprise. This needs to be truly equitable, and we would expect to be able to unpick that from the application that you send in. Please make sure that your joint lead applicants have sufficient time allocated to this project. This is a big undertaking, and we will be looking and encouraging the funding committee to look at the time commitment from these individuals. This isn't something that you're going to be able to do with a very, very small time commitment. As I say, a very clearly defined leadership model with clearly agreed roles and responsibilities is important here. We want to see an equitable split of funding across the UK and ELMIC institutions. If you present to us something that has a very high percentage of the funds remaining in the UK, we will be questioning you on that, given what the scope of the call is. Please make sure that the programme can be delivered within the timeframe and budget to achieve the desired impact. We want to see ambition, but don't be too ambitious. The funding committee are going to need to be convinced that the programme can be delivered within the timeframe and budget that you've outlined. Please also don't present something that's difficult to follow or overly complex. Please make sure that you provide us with evidence that that all the institutions involved support this. We need institutional levels of support from somebody suitably senior within those institutions. And please make sure that your plain English summary is in plain English. We frequently see very, very technical plain English summaries which are inappropriate. Please do engage appropriately with non-experts to get this right, because this is important, and it's very, very important for us to be able to describe the work that we're funding to non-experts through our communication channels, and we often use a plain English summary to help us do that. So please take that seriously. Next slide, please. So for more information, please see the online resources. As I've already mentioned, there's documents related to the core remit and guidance. We have a separate finance guidance. They're all up on the website, and I'm sure that most of you have seen these. If you're successful at stage 1, we will be holding a finance webinar and also an impact workshop for the successful stage 1 applicants to assist you with your stage 2 applications. And if you're successful, we'll notify you of when they will be. And I think that's it. Next slide, please. So I can see there's a number of questions and answers in the box. We're just going to have a very, very quick break now, and then we'll return in say 10 minutes and pick up your Q&As. If you have any questions, we're not going to be taking them through the microphones because of the number of people on the call. So if you do have any questions, please pop them in the Q&A. And we'll be back shortly